Bismillahirrahmanirrahim. Assalamu alaikum. So we were discussing the disturbances in shape, and we did dilustration, taurodontism, dense evaginatus. Today we are going to discuss supernumerary cusps. Occasionally, teeth exhibit additional or supernumerary cusp. The most common example of this phenomena is carabelli, cusps of carabelli, which typically develops on the mesiolingual surface of permanent maxillary first molars. This particular supernumerary cusp usually presents no clinical problem and is therefore considered to simply present a normal anatomic variation. Occasionally, however, certain teeth exhibit supernumerary cusps that result in clinical problems that may require treatment. Examples of such supernumerary cusps are dense evaginatus and talons cusp. Now, first of all, we'll do dense evaginatus. It is a developmental anomaly which is characterized by cusp-like supernumerary focal enamel protrusion on the occlusal or lingual surface of the crown. Basically, एक cusp form हो जाता है occlusal surface पे या फिर अंदर lingual surface of the crown पे cusp सा form होता है, एक protrusion होती है जिसकी वजह से बेसिकली टूथ eruption में और complete development of tooth में problem हो सकती है. Dense evaginatus is a developmental anomaly that primarily affects premolar teeth. It is characterized by the development of a normal globe-shaped projection of enamel in the region of central groove. Lingual और buccal cusps के बीच में premolars के एक central groove जाती है. यहाँ पे एक projection होती है globe shaped and होती वो lingually है. It is called dense evaginatus. It commonly occurs in Chinese, Japanese, Filipino, Northern Native, and American Indian patients and occasionally is seen in the patients of Northern European heritage. In Singapore and Malaysia, this anomaly is properly referred to as Leong premolar, after the name of a person who first drew its attention towards this anomaly. The clinical significance of dense evaginatus is that it can interfere with tooth eruption and result in incomplete eruption or tooth displacement. Now there's an extra the जो form of the dense evaginatus, it's an extra cusp, so it contains a pulp horn. So at regional fracture can result and then pulp can be exposed, leading to pulpal inflammation and its sequel like pulpal damage, pulpal inflammation, necrosis. As with any type of supernumerary cusp, the dentist should be aware that it usually contains a pulp horn and it can be exposed as a result of functional atresion or if mechanical reduction or removal of the cusp is attempted. If you try to remove it mechanically, like trim it or trim it superficially, you can expose pulp horn and then it can result in the damage. Now next is talons cusp. An uncommon but clinically significant form of supernumerary cusp typically seen on the lingual aspect of maxillary central incisor is called a talon cusp, as you can see in this picture. And dense evaginatus is seen here and here lingually, and in this B picture, the upper picture, you can see a projection, globe-like projection, a ball-like projection. So it is called talon cusp because its unusual shape resembles an eagle's talon. This abnormal cusp arises from the cingulum portion of the tooth. Cingulum portion of the tooth is the portion in a bulging portion, the cemento-enamel junction, the root and enamel junction में जो एक bulging सा थोड़ा सा portion होता है, it is called cingulum. Cingulum portion of the tooth and usually extends to the incisal edge as the prominent projection of enamel that imparts a T shape. Occasionally, deep lingual pits develop on either side of talon cusp where it joins the lingual surface of the tooth. If lingual pits are present, they should be restored. Otherwise, they will result in dental caries and eventually damage to the whole tooth. If the cusp interferes with normal occlusion, preventive care that includes endodontic and restorative treatment of the affected tooth may be required so that the tooth may achieve normal tooth form. Simple reduction of the cusp should not be attempted because the pulp cusp contains a prominent pulp horn, therefore pulp exposure is almost certain to occur. Although this abnormality is uncommon in general population, it has been reported to be more prevalent in patients with Rubinstein-Tabby syndrome. So the syndrome related to talon cusp is Rubinstein-Tabby syndrome. Now, supernumerary roots. Additional roots more than the expected number are termed supernumerary roots. This is a common developmental phenomenon that is most often seen in mandibular premolars instead of like in maxillary premolars you can see 3 roots instead of 2. It is also seen in cuspids. It is also seen in maxillary and mandibular third molars. Before dental extraction or endodontic treatment are undertaken, it is therefore important to radiologically image the tooth. Always take radiographs so that you know before root canal treatment or extraction that how many roots are you expecting, what is below the gums. So and when you will see the radiographically, when you will see how many roots are there, is there any supernumerary root, is the root tilted or not, it will facilitate your treatment planning. Now next is gemination. Gemination is a developmental anomaly characterized by single rooted tooth with either an unusually wide partly divided crown or two separate crowns, thought to be represent the result of incompletely divided tooth germ. Double tooth. Basically, there it is a single tooth which is divided, but you actually see one more tooth, like in the arch. It affects anterior teeth and clinically resembles another anomaly known as fusion. Clinically, if you will see without radiograph, it just resembles fusion. Although they are the fusion and gemination both result from two different developmental processes. Gemination is characterized by the partial division or twinning of a single tooth germ, resulting in the tooth that exhibits two separate or partly separated crowns but a single root and root canal. Whereas fusion is different. It is basically result from the union of two adjacent tooth germs. Gemination can affect deciduous and permanent dentition. Now this is fusion. As you can see, it resembles gemination. It is defined as a developmental anomaly that is characterized by an abnormally shaped tooth that may exhibit an unusual wide crown, a normal crown with an additional root, or other combination that result from the union of two adjacent tooth germs united by a common dentine. Basically, in fusion there are two roots, and in gemination there is only single tooth germ, so single root. Fusion is defined as the union of two normally separate tooth germs. The minimal criteria for fusion is that the teeth in question exhibit confluent dentine. This developmental dentition condition can occur in deciduous and permanent dentition. Some hereditary tendency has also been reported. Fusion can be complete or incomplete, and its extent will vary with the stage of development that the tooth has reached at the time of fusion. जब fusion हो रही थी उस वक्त कितने development हो चुकी थी tooth की. If fusion begins before calcification, तो फिर calcification से पहले हो गया तो it will involve all the components of tooth, enamel, dentine, cementum, pulp, सब. If fusion begins at later stage of tooth development, then the fusion may be limited to the roots only, and the teeth may have separate crowns. The pulp canals, the roots will be fused, but the teeth will be crowns will be separated. The pulp canals may be either fused or separate. Fusion can be differentiated from gemination by counting the teeth in the area. In the case of fusion, there will be one less tooth present in the arch. Okay. The clinical implication of fusion include aesthetic consideration, crowding when fused to supernumerary tooth, and periodontal disease. These things are worrying. Now you can see the difference between fusion and gemination. Basically, single tooth germ, but you see like it seems like two teeth. But in fusion, the two tooth roots are joined A fusion may be complete or incomplete. If it's a complete fusion, then it will extend up to the crown, but if it's incomplete, then it will not extend up to crown, it will just be roots. Now next, concrescence. Union of the roots of two or more normal teeth caused by the confluence of their cementum. Concrescence is a type of fusion that occurs after root formation is complete. Union of teeth is limited to and is a result of confluence cementum. The condition is thought to occur as a result of traumatic injury to the area or crowding with interseptal bone loss. Therefore, it results in close approximation of the tooth roots. The tooth roots are joined together, they are united, but the crowns are totally separate. Concussions can occur before or after tooth eruption and primarily involves the permanent maxillary molars. Usually, it involves only two teeth. Now, obviously, without radiographic diagnosis, you cannot conclude that is it concrescence or not. Therefore, to recognize the concrescence, you must take a radiograph before extraction. Tooth extraction. Failure to recognize its presence can result in extraction of two teeth when a single extraction was intended. So that's all for today. Next, we will do hypercementosis and cervical navel projection. Thank you.